Dr. Legge, you mentioned a subcutaneous pump. What is that, and how quickly can we, is that available now?
Yes, it's available now, and it's been FDA approved for, I believe, about 2 years or ballpark. And the remarkable pharmaceutical heavy lift was figuring out how to make tablet carbidopa levodopa activate subcutaneously through alkaline phosphatase infusion. Enzyme activates this medication that's infused through a tube that's attached gently under the skin. And this infuses throughout the day your dose of phos-carbidopa, phos-levodopa, and it's then activated into levodopa through the body's own enzymes chemistry. And it does require some training, and for patients that are having, I think, more of the motor fluctuations, or what I may term as heavy pill burden. We're taking several doses multiple times a day, and we're really having a hard time staying on the clock. And we may be having a lot of oscillations or fluctuations throughout the day. This starts to make sense. And it may be a temporizing measure, perhaps before something like deep brain stimulation, or maybe an answer for those patients who are not a good candidate for deep brain stimulation. The subcutaneous infusion form is, I think, an advancement over a more older form called the Duopa pump. And that is a difference. That is through a tube that's delivered to the small intestine through a feeding tube. The Vyalev pump through the subcutaneous is just through the skin, and so less invasive.
That's great, because my father had the Duopa pump and it was challenging. So this new one, it sounds like it's not really isn't cumbersome, isn't something that people really will have to hide or.
No, and I think the company does an excellent job with Vyalev to provide. It is about the thickness of 2 cell phones. The pump itself, but patients who have diabetes or insulin infusions, we have crossed this bridge before, with wearables and things to hide that, and patients go live life with it. So yes, we've overcome those challenges.